Hello everyone. A 25-year-old woman came to emergency department with sudden onset abdominal pain, nausea and confusion. So for the past 2 years, the patient has quit the smoking and alcohol after seeking some medical advice, and her lipase, serum lipase and LFTs are within normal limits. CT scan CT scan shows no abnormalities. Sample of her urine is reddish in color and darkens on standing for 24 hours. So IV dextrose has been administered for the patient, and that has improved the symptoms significantly. So what is the reason the patient responded very well for the dextrose infusion? So which pathway is influenced by the dextrose infusion? So options are gluconeogenesis, fatty acid synthesis, ketone body formation, porphyrin synthesis, protein catabolism, or purine degradation. So by this time, most of you got this presentation. So whenever you have a patient who is at the who is in the 30s or early 30s or 40s, right? So usually they can have this kind of presentations called the acute intermittent porphyria. So we are dealing with the case of a acute intermittent porphyria, right? So the patient is likely suffering from this condition, which is an autosomal dominant disorder of heme synthesis pathway. So here the patients will have the problem with the enzyme called the parfo bilinogen deaminase deficiency. So the PBG deaminase deficiency is a major problem with the patient. So usually here, whenever you have this kind of PBG deaminase deficiency, so the patient will have more of neurological symptoms and abdominal pain will be there. And remember the fact here, usually here no photosensitivity. So the patient will not have any kind of photosensitivity rashes or photosensitivity symptoms. So whenever you have this photosensitivity symptoms, it can be seen in the cutaneous porphyria, and which can be seen in the later part. So here, whenever you have any deficiency, the patients may have photosensitivity will be there, right? So apart from that, the patient is suffering from abdominal pain, neurological manifestations, and also the dark colored urine. So the dark colored urine is due to the increased excretion of parfobilinogen. So whenever you have too much parfobilinogen is excreted through the urine, so this oxidation of this parfobilinogen in the urine can cause this dark reddish color changes. So that explains the patient presentation of reddish urine in long-standing cases, right? So here the patient is suffering with the PBG deaminase deficiency, and which is reason for the presentation. And we all know that this is controlled by the PBG production is controlled by this ALA synthase, which is the rate limiting enzyme here. So whenever you have a rate limiting enzyme in any pathway, you should know that what are the factors which can enhance the rate limiting enzymes, what are the factors which can inhibit the rate limiting enzyme. So here the factors which inhibits the rate limiting enzymes are including glucose and heme substances. So that's why the patient responded very well with the dextrose. So whenever you give a dextrose, so especially like the 10% dextrose, whenever you give this dextrose, so the dextrose is going to inhibit the patient's the peroxisome proliferator activated receptor gamma. So this inhibits the ALA synthase activity and improves the symptom of acute intermittent porphyria in the patients. So the acute attacks can be prevented by giving you the dextrose for the patient, right? So and also the hematonics will be helpful, right? So remember the clinical vignette. So patient also recollected that patient quit the smoking and alcohol. So even the smoking and alcohol can enhance the episodes of acute intermittent porphyria, right? So that's the reason the patient, after seeking some medical advice, has quit the smoking and alcohol. So smoking, alcohol can precipitate the attacks, acute attacks, and hematinic substances and glucose and dextrose can inhibit the ALA synthesis activity, by which it can reduce the formation of your parphobelnogen. So that's how it works. So the patient is presenting with the presentation of acute intermittent porphyria. So that's the take home message. The other choices, unlikely that the other metabolism is influenced here. So it is of heme metabolism. So we know that the heme is the major component for your hemoglobin, and makes a major role in your oxygen transport. So whenever you have this pathway deficiencies, the PBG deaminase deficiency, so there will be too much accumulation of parphobelnogen substances, and this parphobelnogen substance accumulations is responsible for the neurological symptoms and also the abdominal pain manifestation. And remember that, so the excess parphobelnogen will be excreted in urine, and that is one of the important criteria for you to diagnose the cases of porphyrias. And porphyrias patients, like long-standing urine may turn into a reddish color, dark reddish color, which is due to oxidation of parphobelnogen substances, and which is seen in our patient as well, right? And also you should know that a rate limiting pathway in your porphyrin metabolism, so ALA synthase plays a major role here. So you should so that's it's they are applying this principle for treatment. So they are giving the glucose. So glucose is an inhibitor, it has a negative influence on ALA synthase activity, so by which it decreases the formation of gamma aminolevulinic acid, and also decrease the formation of parphobelnogen, and also it decreases the neurological symptoms, and also the acute attack precipitation will be prevented or decreased, right? So that's the presentation of our case of 25-year-old woman who come to the emergency department, right? Thank you. So it's a case of acute intermittent porphyria.